afternoon, everyone.
Happy Wednesday.
Happy Wednesday. It's hump day.
Hump day. Hump day.
You know, at the McDonald's, that reminds me, by my house, they have, like, the little window.
Like your drive-through window?
Yeah, where you pay.
Yeah.
And they always have, like, something funny written on there, or just, like, you know, have a great day.
Sure.
Well, one day it was happy hump day, something or other. But I'm like, okay, do they write it on there, like, backwards? Like on the inside, or does someone like stick their hand out and write it on the outside of the, I don't know.
Maybe they walk around the outside and write it just normal.
That's not one of the options. It's not one of the options.
I like that one of the options had to be that they had to like read it.
I mean, I could. I'm pretty good at writing backwards.
You could. Oh
yeah.
my god. Can you imagine if I can't even write regular.
No, you can't.
I mean, your child can write better than I can, I'm
yeah,
sure.
Pretty much. I mean, I had to take a special class to know what you were writing.
That's right. I took a special class to have illegible writing, so.
But see, you're so good at problem solving, just like when I wasn't sure how to make my picture go on a canvas that was this way instead of this way. Yeah, we won't talk about that. But, I don't know why hump day that reminded me of the McDonald's by my house. There was one day that something was spelled incorrectly, and I was like, maybe you shouldn't do that
Get
anymore.
out a little tissue and like erase it.
Well, no, because I wasn't sure which side of the glass it was on.
See, that would have answered the question for you.
It would have.
Mm-hmm.
I'm like,
known forever.
It's probably not a good idea. It's nice to write things on there, but if you can't spell them right,
it's McDonald's, so.
Yeah, but if they want to get paid more per hour, they should know how to spell things.
What was it? Do you remember what was misspelled?
I don't even remember. No, because it's something different-ish every day, so yeah, who knows.
So today, we're going to talk about some roids.
The roids.
Some steroids.
Yep.
Want to hear my song?
I'd love to. Maybe I shouldn't take a drink while you play.
Do you like Rage Against the Machine?
I can't say that I do.
Oh. Well, that's unfortunate.
I don't know for who.
But okay. So let's talk about steroids. Steroids. So what's the full name? We usually just say steroids, but there's actually a full name. Corticosteroids.
Oh, I was like,
I know there's different types of steroids. You know, they got like anabolic steroids, corticosteroids. There's all these different kinds. What we're referring to today specifically is corticosteroids. So that's going to be like, you know, what most people think about when we talk about steroids, like prednisone, prednisolone, dexamethasone. All of those are steroids. Methylprednisolone, triamcinolone. Mm-hmm. You'll notice a lot of them end in "one." Not always, but hey, I had to create little ways to remember drugs in school, you know.
There are a lot
like
of
all
them.
the Psyllin drugs are these, and all the azole drugs are these. You know, and you kind of come up with ways to remember what was what, because you can't memorize all of them like that. You can't.
That someone can.
Oh, I'm sure someone can. I can. So yeah, so we're talking about those sorts of steroids. We're not talking about like testosterone or like the anabolic steroids, the illegal ones that they worry about like athletes taking. That's a completely different thing. So what we're looking at, like I said, prednisone is probably the most common one that most people have heard of or know about. Related to that is prednisolone. So those two basically are the same thing. The difference is that prednisone is broken down in the liver to create prednisolone, and that's the active molecule in the body. So we tend to use prednisolone preferably, just because it's less effort for the liver to break it down. But there's different uses for steroids, like so many uses for steroids. And there's also a lot of times that we don't want to do steroids. So when we look at steroids and steroid use, there's usually, it kind of falls into like 3 main categories-ish, 2 or 3. So we'll usually do, there's like a physiologic dose, which we'll talk about what that is. There's the anti-inflammatory dose, and then we have the immunosuppressive dose. And so lowest is physiologic, highest is immunosuppressive. So that kind of helps break down like what use do we have for it, and then that tells us what dose they're going to be on as well. So let's start in the middle, because that's the most common category of how we're using them, is the anti-inflammatory sort of steroids. So what kind of conditions would we use that for?
We can use it for skin.
Like what?
Like allergy type stuff.
Mm-hmm. Yeah.
Let's see.
That's probably the most common reason.
Yeah.
Is using it as an anti-inflammatory, anti-itch for skin. So yeah, a lot of allergy patients. It used to be that was all we had with steroids. And of course, lots of downsides to that. But yeah, that's probably the most common reason that we will prescribe them. We can also use them. So sometimes we'll start off at the higher end of like the immunosuppressive dose and work our way down to just be anti-inflammatory. So on the immunosuppressive side, so we're trying to suppress their immune system, so turn it down, meaning they have some kind of condition where their immune system is attacking their own body. So that's going to be like an IBD sort of situation. So inflammatory bowel disease, that's something we see in cats.
ITP.
What's that?
ITP.
ITP. So yeah, what is that?
Why do I
Immune-mediated thrombocytopenia, or immune-mediated hemolytic anemia, so like your body's attacking your platelets or your red blood cells. Those are good reasons to be on immunosuppressive doses of steroids. Another immunosuppressive dose that we would use would be for certain cancers. We can use that for mast cell tumors. We can use it for lymphoma. So that's another reason that we would be on that high end of the dosing range. So we're trying to, like I said, turn down the immune system. So yeah, so depending on the dose that we're giving, we may see different benefits. So, why are you
right there,
me? I'm just having issues today. It's fine.
Okay.
Don't mind me.
Okay. I'm just here to look pretty. You're doing all the talking. I'm doing a terrible job at it.
So you might want to work on this.
I know.
Linda Laura's going to get on again and yell at you.
Probably. It's just my face.
It's just my face, Linda.
My face.
So, what was I saying? So those are the different ranges and the different conditions that we would use steroids for. So what are some of the side effects that we can see from steroids?
Want me to get it? Oh no, someone.
Oh, yeah. Oh, they got it.
So increased urination,
Uh-huh.
increased thirst.
Yes.
So we call it PUPD.
Which stands for what?
Polyuria, polydipsia.
Which one's which?
Polyuria, more peeing.
Mm-hmm.
Polydipsia, increased thirst.
Yep.
And of course, since they're drinking more, they're going to the bathroom more.
Mm-hmm.
They can be like really, really hungry.
Oh yeah.
Let's see. They can be more irritable as well.
Mm-hmm.
Yeah, panting.
Yeah, sometimes they'll be like irritable or anxious, and sometimes they'll be dopey. It definitely varies from patient to patient. There's not really a way to predict how they're going to react in that way.
It's pretty similar in people, I believe.
Mm-hmm.
Although I've taken steroids because I get poison ivy really, really bad, and I've had it like every year for the last 4 years, 5 years, something. I think I've skipped the year when I was pregnant, maybe. I skipped 1 year either when I was pregnant or right after I had Lincoln. I don't remember. But yeah, pretty much every year for the last like 5 years I've had poison ivy. Mm-hmm. And I typically have to take oral steroids, but they never really affect me. Like I don't really feel any different, but I think I'm just a weirdo.
But that's true. I mean, yeah, different people and different animals have different steroid tolerances too. Some of them are very sensitive, and some of them are less sensitive. So cats tend to be a little less sensitive, I think, to steroids. We usually use a higher dose in those guys than we do in, say, a dog. But again, depends on what we're treating. But so yeah, some pretty nasty, like, short-term side effects. So while they're actually on the drug, all the ones that Crystal said, those are things that we can see. But there's also long-term effects that we can see. So it can affect their kidneys, their liver. It can affect their heart as well. So an animal has known heart issues, we try to avoid steroids in those guys because it can make heart disease worse. So that's a reason that we prefer not to use steroids wherever possible, although sometimes that really is the best course of treatment. Other things that we'll see, especially in cats, is it can cause them to become diabetic. So especially with chronic steroid use, the way steroids interact with insulin, so basically it makes them resistant to insulin. So their body's still pumping it out, it's just not working the way that it should. And so that will cause them to be diabetic. So, we hope that if we withdraw the steroids that maybe we can get them into remission, but that's not always the case. So yeah, it can be irreversible. So that's a concern. Because certainly I think, there's a lot of the times cats just in general are difficult to medicate.
They are.
That's just a fact. And so, it sounds really appealing to say, oh, well, let's just do the long-acting steroid injection for, like, all the things. And the problem with that is you're more likely to get, the insulin resistance and the long-term effects and all that. Because we don't see as many of the short-term side effects, like the increased thirst, increased urination with cats that we do with dogs. Like I said, they're just not as sensitive to it. So we don't see all those short-term effects, and so we're like, oh, great, but it's helping their itch, or it's helping their ABD, or whatever it is, and it's cheap, and so it's really appealing to a lot of people, but the downside is that we are causing damage with long-term use, so that's why it's not ideal. So then we start talking about, are there other treatment options, or could we at least get to where we're doing something daily, to where we can, like, control the dose and lower their dose and get down to the lowest effective dose. That's always the goal with steroids treatment, is the lowest effective dose. So like I said before, sometimes we have to start off higher, control that initial inflammation or whatever it is, or the cancer, and then we taper them down to where they're still doing well clinically, they still feel good, whatever, but we're at the lowest possible dose that we can get away with.
Because quality of life still matters.
Yeah.
It's still important. We still want them to get to where they're comfortable, but not killing off the rest of their body.
Prefer to not, be killing other parts of your body at the same time. So like I said, it sounds really easy. Oh, just give them that cortisone shot. There's reasons why we don't prefer to do that. Thankfully, it comes, obviously, they come as pills. There is a short-acting injection, there's long-acting injections, but they also do absorb pretty darn well in the transdermal ear gel. So it just goes on the inside of the ear flap. And so you just it usually comes with like a little click pen or a syringe. You put a couple clicks on the inside of the ear. So that's nice for cats too, because yes, you're having to medicate them, but at least you're not trying to get them to take a pill or shove something down their throat. Because most cats are really they're just not really cool for
they don't like it
for meds or any kind of medication by mouth. So usually we can get them to at least be okay with a little bit of stuff on their ear. So
yeah. And cats are smart. They're smarter than dogs most of the time.
Yes, they are.
They're gonna catch on that every morning and every night you're doing these things, and it's gonna be a lot more difficult to find them.
Yes.
Your dog is like, oh, hey, you're home. You want to put something in my ear? You want to shove a pill down my throat? Okay.
Make some peanut butter? Okay.
But then your cat's like, psh.
Yeah, they flip you the bird and they go hide under the bed.
Exactly. Yeah, or like my cat who will just run outside and be lost for
And
a couple days.
Yeah, exactly, and that's something we take into consideration as well. So yeah, that's why cats are a lot more difficult. So with steroids, like I said, we try to get down to the lowest effective dose. And even if it's something that we're just doing in the short term, we have you taper the dose. Sorry to bore you, Crystal, but
okay.
Can you tell us why we taper the dose?
We taper the dose because steroids is not something that you just want to stop abruptly.
Exactly.
Because it can cause lots of other issues.
Yes. Yeah. So what happens is, like we talked about in the Cushing's and the Addison's videos, your body produces a steroid hormone normally called cortisol. Cortisol is important. It helps your body cope with stress.
Cortisol is important.
It is. It's not just junk. So you need a little bit of that all the time. So when we start giving your pet what we call exogenous steroids, so meaning we're giving them a steroid in a certain, whether it's a pill or an injection, doesn't matter how, we're giving it to them, their body is going to turn down their production of cortisol. And it can be to a point where it's below what they would need to be able to survive. So if you stop the steroid abruptly,
let's say they're getting it twice a day, and you're like, oh, they're just peeing all the time, and they're drinking their whole bowl of water.
Or he's doing better. We're going to be done with that.
Yeah, either one. I'm just going to stop giving it to them.
Yeah, don't do that.
No. Keep going.
Don't do that, because we need time for their body's cortisol level to come back up. So as we taper them down off of their oral steroid, then their cortisol levels can rise. This whole feedback loop thing. So we need that taper for their body to be able to catch up. Otherwise, they end up in Addisonian crisis because they don't have any cortisol production. So they can get very, very sick, and then you end up at the emergency clinic, for a couple of days, and it is something that can potentially be fatal. So that's not good.
Is that the one that's reversible, or sometimes it's not?
What, Addison's?
Yeah.
No, Addison's. Well, so
like an Addisonian crisis.
If it's So if it's because of steroid use, I mean that you just have to get them back on steroids and then taper it off properly, and hopefully their body catches back up. But so that it's not necessarily that it's reversible or it's not reversible. We just haven't had a chance for their body to respond. So they just need that chance. There's also what we can see, I mentioned Cushing's disease, so that's the opposite of Addison's. That's where there's too much cortisol. So that's why a lot of the signs and symptoms that we talk about with Cushing's disease is the same thing as if the side effects on being on steroids. And we can get what's called iatrogenic Cushing's. So where it's because of steroid use, we're seeing all these other signs of Cushing's, the hair loss and the pot belly and all that, and that's with chronic steroid use. And in that case, yes, if we withdraw the steroids, it should fix it. But those are things too. So what else? What?
I just feel like you're staring lovingly into my eyeball.
Oh my.
She's not going to look at me again.
I'm not going to look at her anymore. It's weird.
What else were you going to say?
I forgot.
My dear.
I have forgotten already. Dang it.
What else can we see? Something? What else something you were going to say?
I lost it. I mean, I lost it a long time ago, let's be honest. So that's why too. These are all reasons that we don't just throw steroids at things just for funsies. There's also certain conditions where doing steroids can interfere with our testing. Steroids, because they naturally suppress the immune system, they can make infections and things worse. So that's something else that we have to take into consideration. So when we're looking at an eyeball, so we can use steroids topically, so we can use it as an eye drop to bring down inflammation in the eye. However, if your pet has a corneal ulcer or a scratch, that would be a time that we would not want to do steroids because it will inhibit the healing. So that's why we try to be careful about it. Like I said, it's always something that's really attractive because they tend to work. They're
usually
super
pretty
cheap.
Quickly.
Yeah, they're super cheap. But there's a lot of problems that go with that. So, back in the day, it was one of the few options that we had available to us. You get a shot of Pen-G and a depot injection.
Because you're so old. That's all they had.
Well,
literally all they had in the 1800s.
Well, in the 1700s when I first started practicing veterinary medicine. It was a shot of Pen-G, so penicillin, and a shot of depot, so that was steroid.
Both ways?
You just covered both ways.
Both at the same time?
That fixes everything.
Did they get them both at the same time?
Yeah.
You got your antibiotic and your...
Yeah.
Hope it takes care of it.
Yeah,
whether they've got an infection or
But truly, back in the day, when there was limited information, that was something that was done, and there are some places that I see that still do those sorts of things, and it's very questionable, but
it's very questionable.
But it's cheap, and sometimes animals get better despite what we do.
Maybe that's all my rabbit needs. She just needs a shot of a steroid, a shot of some.
It'll make her less crabby.
Maybe.
Oh no, the phone. The phone. They got it?
Yep, they got it. It's tap water.
Oh yeah, it is that time of year.
It is.
This is our life with the phone. Let me tell you. If for some reason you ever call up and the phone rings and goes to voicemail and we are open, that's why. Because we have 3 phone lines, and sometimes we have less than 3 people working at any given time. Or if we're in the middle of something, just leave us a voicemail. We'll get back to you, I promise. Was it a wrong number?
No, it was a client, but there was no one there.
Oh,
so.
Well, that's weird.
Hello?
That's strange.
Hello?
You're just gonna bring it with you.
Yeah.
Good call. Good call.
There we go. I'll just answer the phone while.
Hey.
Thank you for calling Premier Pet Care.
Like we're taking live calls.
That would be fun, wouldn't it?
Oh,
we could tell people their horoscope, or we could deal some. What are those tarot cards? And be like,
why would those be things that we would do?
I have no idea, but I think
instead of answering questions.
I think it would be fun. Be like, I have no idea what this card means, but I'm gonna make some stuff up.
We could just draw our own tarot card. It's fine.
We'll
just make up.
Kelly, what is this? Some sort of pig? What is this?
When might I draw my generic mammal? And then I could write on the back what it is, but then it'll just look like some kind of hieroglyphic.
Right.
Nobody can read my handwriting.
That's true. It's like
Sometimes
you can either guess the picture or you can guess what it says.
These would be great.
Wouldn't that be awesome?
Oh man. So the steroids.
You could draw them and I could just explain what they are. We'd have no idea.
We would have no idea. So big takeaway with steroids is they're not the be all end all of everything. Lots of side effects. Definitely follow directions. If your pet is prescribed steroids, follow directions. And you try to always tell people, if we send you home with steroids and the side effects are driving you bananas, do not stop them. Call us first, and we can direct you on how to taper it maybe a little bit more quickly if we need to. But we always need to taper it.
Yes, because generally it will be either like a 3-day or a 5-day, sometimes a 7-day wean. So what that means is if it's like a 3-day wean, they'll take it twice a day for 3 days, and then they'll take it once a day for 3 days, and then they'll take one every other day until they're gone. So generally they start feeling better after 2-3 days on it.
Yeah.
And that's when we start to wean them off. Now, if it's something more serious that, they're having a really bad reaction to something or whatever, we may do longer, 5 or 7 days.
Yeah. Or if it's something, like some of the immune disorders, like that dog that had the masticatory muscle myositis. So his body is attacking his the muscles in his skull.
In his
words. Here. And so those are responsible for allowing them to open and close their jaw, and so obviously that's bad.
It's really bad.
Poor little guy. So he went on big doses of steroids for an extended period of time. So he was on it for like 4 weeks, and then we start tapering him off, trying to get the condition under control. So sometimes we do the higher doses for longer. It just depends on the condition. It's your duty to follow directions. But yeah, so we always will direct you on how to do that safely.
Yeah. So don't just stop them when they're feeling better.
Don't just stop them, please.
Bad.
Yeah.
Bad.
Yeah. We don't want anything bad to happen. Anything else that you can think about right now about steroids that we need to mention? Nope.
Why was that so funny?
I don't know, just the way you were like, no. I don't know. It was just weird. It was weird.
Your face is weird.
Well,
you should
it
be
is.
used to it.
It is. All right. Well, we will see you all next week. If you think of any other questions, of course, always you can leave us a comment. We're happy to answer questions after the fact, or you can just call Crystal. Call 1-800. Call Crystal. I'm gonna set you up a number. 1-800.
Call Crystal.
Call. No, that's too many numbers.
1-800 Crystal.
1-800 Crystal, maybe.
That would work.
Yeah. We'll see if we can find that number. All right. See you guys next week. Bye. 1-800 Crystal.